some famous quotes from other urologists who come before me about positive cytology in the setting of a negative endoscopy or imaging is that no one ever died of a positive cytology. So that may, in many cases, and I think Mike Polisi has shared data on this before, and that sometimes positive cytology will precede the finding of cancer in the upper tract. So we would typically just follow that patient more aggressively and with frequent imaging.
Move on with our next speaker, Dr. Rania Baza, who's from Ohio Health, Director of Robotic Surgery, and going to give us a talk on fluorescence imaging during robotic partial nephrectomy for margin assessment.
So there's two ways that the Firefly is used during robotic partial nephrectomy. By far the more common one is to assess perfusion. The other one is for margin assessment. And this is one that I think very few people use the Firefly for. Here's another example. So this is a tumor that I've resected, and after I resected it and I'm checking my margin, I'm looking over here and I'm saying, okay, what am I looking at here? Is this the pseudocapsule of the tumor? Is this something else? Should I be nervous about this area in the middle right here? But it's green. So this was really just some collecting system overlying a renal pyramid that was projecting in the collecting system.
We are going to start with the case presentation. Amar is going to do a case presentation first. Please go ahead.
Hi everyone. So our patient is a 46-year-old male presented with an incidental finding of a 2.5 centimeter right renal mass.
Just showing you down here, this is gonadal vein, right, coming up.
Right.
And so I've just reflected the colon down, and I've just reflected a little bit of the duodenum.
And there's some provocative data there suggesting that there can be a benefit. But again, these are highly selected, and you have to work very closely with your medical oncologist and make sure that you well educate your patients in terms of what the goals of this approach are going to look like. And I'm not saying that this is something that I would necessarily advocate, but there will be data coming out.